Cat TV is celebrating 30 years of community media. Help support Cat TV's next 30 years by becoming a member today. Your membership will help us continue covering meaningful, local content. Thank you for supporting your local community media station.
Good afternoon, everybody. On this Monday, November 7th, I'm Matt Harrington with the Southwestern Vermont Chamber of Commerce, and you are watching ShiresHEALTH. We started this series, this telecast, in partnership with Cat TV, as well as the Southwestern Vermont Medical Center during the height of the pandemic, just as a communication tool, just as a way to communicate with our communities, to give sound and real and good advice, whether that be dealing with COVID or vaccines or boosters, or even getting ready for the holiday season as we all kind of go see families from all different parts of the country, and we want to prepare you. So here we are again, and we like to do an episode like this right before the holiday season. So here we are in November, preparing for Thanksgiving, preparing for all the holidays in December and even into January. And we want to make sure you have the best, most accurate, most up-to-date information possible. With me, joining me is Dr. Dobson. He's on our show often. We appreciate his sound advice. He's the Chief Medical Officer for that Southwestern Vermont Medical Center. Welcome, Dr. Dobson.
Great to be here, Matt. Thanks for having me again.
Yeah, absolutely. So let's get right into it. Let's start with the question that everybody's wondering, and we're, dare I say, a couple years out of the height of the pandemic. We've been introduced to vaccines. We've done a first round of boosters. We're into our second round of boosters, even a third round of boosters. How are we doing? Are they working? What's going on?
Those are all great questions. And actually, you know, I feel like we are all getting a little bit of a mixed message, because we hear that things are going well, that despite the high prevalence of the virus, our immunity from both vaccinations and from exposure to the virus, you know, almost all of us have been exposed, even if we haven't tested positive, is a good thing. And that means that when we do get COVID-19, for the most part, it is a milder form. Just think about the people you know or yourself. Most people have had the disease, are exhibiting more minor symptoms, more cold, maybe more like flu symptoms. They're out of work for 4 or 5 days, able to return with a mask. You know, that is not what we were talking about 2 years ago. People were out 15, 20 days, scared, anxiety provoked. The work wouldn't let them back in, you know, all these things. So that's on one hand, and those are all real and good news. On the other hand, you still hear some of the fears and dangers and hospitalizations, and that is true. Those that are vulnerable, again, that's the people over 65 and those with medical conditions, still can get very sick with COVID-19. We're still having hundreds of people die per day in the United States, and continue to maintain our vaccination status, as well as be ready to be treated with Paxlovid or some of the other treatment modalities if we are, you know, at risk. If you're not at risk, if you're under the age of 50 for sure, then you don't need to be as concerned about pursuing treatments. You do need to be wary if you have symptoms and don't spread it to others.
Great. What you kind of mentioned vaccines and kind of specific to Southern Vermont, how are we doing in terms of number of people vaccinated and even boosted at this point?
Yeah, so I think people will recall, we won't go over all the numbers and graphs, but that Vermont did very well in the initial primary vaccination stage. We didn't do as well as we had hoped in the booster stage. However, we have surpassed most states in that regard, and particularly in Southern Vermont. And I do believe this is because of the access that SVMC and other community partners have worked hard to develop. The boosters uptake is much higher than in many parts of the country. It's still not exactly where we want it to be to prevent hospitalizations this winter, but we are continue to give the vaccine up at the prior Southern Vermont College campus, as well as many doctors' offices and local pharmacies, as people are aware.
Great. And we should mention for people watching live right now, thanks to the technology and capability of Cat TV, if you are watching on Facebook, please leave us a comment, a question in that comment bar. We will try and get to those questions. We have a couple more for Dr. Dobson, but part of this is the engagement and interaction with our community. So if you do have questions, if you have been wondering, you've been looking at a couple articles or watching some news, now's your opportunity to ask Dr. Dobson. So please put a comment into those comment bars. I want to ask, we just got over Halloween, and you and I live on the same street, which is a crazy time for Halloween and dare I say a nightmare on Elm Street. But hundreds of kids here in Bennington. How did we do with Halloween? Are we seeing any uptick because of that? I know in years past we've seen more uptick in after Halloween. Do we have numbers on that yet?
We don't. We probably won't, Matt. And that's a really good question. Let me see if I can address it in a way that just makes statistical sense. You know, in previous holidays, whether that's Halloween, and then of course the next one will be Thanksgiving, and then all of a sudden Christmas, and the data would show from the state, look at how the prevalence of the virus or the prevalence of the disease has increased right after these holidays. The reason we're not seeing that is, if you recall, back then, let's just take Thanksgiving visitation, for example. Everyone was wearing masks elsewhere, and then Thanksgiving would happen, so it was easy to see that uptick. Now that we're not doing that, frankly, you were as likely to encounter the disease on a Halloween excursion than you were the week before, just at work or in life. So we're probably not going to see that type of variability due to holiday events. What we will see, you know, probably moving forward, as we do with all respiratory illnesses, is an increase in when we switch from seasons, summer to winter, you know, fall to winter, because people start gathering indoors more. But that is a great question. I am sorry, I'm going to jump back to the previous thing real quick on vaccinations. I made myself a note to make sure to get this out. A couple of things people ask, and you had asked earlier and I didn't answer, how effective are the vaccines? I just want to remind people that just because the vaccines don't prevent or wholly prevent infection, they do some really great things that I personally know I would want to benefit from. For example, they cut down the number of days you're sick. Who wouldn't want to be sick 3 days as opposed to 7 days? They allow you to return to work and school better. Who doesn't want to, well, I should say this, parents want kids to be educated and be in school as much as possible. And then again, the severity of the illness. You know, you hear about people all the time and they have to miss work for a few days for cold-like symptoms. That's far different than the terrible symptoms we were experiencing. Now, people still do experience terrible symptoms. So if someone's online and they're saying, wait a minute, I got it last week and it was horrible. That is true. It still can be very horrible. But in general, the vaccination decreases the risk and the severity. And then the last thing, I know that some people were having reservations about the first vaccines that were available. There are now other vaccines available, probably equally efficacious against the virus that causes COVID-19. This technology is the same as the vaccines you've been receiving since childhood. And so if you were in that camp and were holding out or didn't want to get a booster, now is the time. All of those things are available. All of these vaccines are available up at SVC, and most are available in different pharmacies and other locations.
And Dr. Dobson, I mean, at this point, we also have true scientific data. People have been vaccinated now for a year and a half or more. They've been boosted multiple times. I mean, if there was going to be this great big windfall of, you know, who knows what, deaths or something because of vaccines, wouldn't we have seen it by now? So even if people were holding out that, you know, we've seen that people are moving on with their lives, living better lives because they're not becoming sick as much and for as long as you had just mentioned. We keep hearing this concept around triple threat, and other than a wing style at Ramontos, what does triple threat mean when you hear that in the medical sense?
Yes, absolutely. And we can come up with other analogies there. So in regards to triple threat, people are talking about influenza, RSV, and COVID-19. And I'll add, it's really quadruple threat because rhinoviruses, which cause everything from minor common colds to severe illness in those that are at risk. So it's really these 4 viruses that are respiratory viruses that you would expect to increase in the winter. Here's what's different. The media has done in one hand, an excellent job of raising awareness and bringing the facts forth to people, but it's also been a little sensational because, frankly, it's something to report on. So the truth is that RSV is at a higher rate than we normally expect, and that is most likely due to the fact that RSV affects infants and toddlers 1 to 2 years of age. And most infants and toddlers each year are exposed to RSV. 1% of them actually need to be hospitalized. The remainder just have colds. You don't even know that they've got a sickness, or you may know that, but you don't need to take them to the doctor. Well, over the past 2 years, those infants and toddlers have not seen the virus because people haven't been traveling, they haven't been in contact with others. Yes, there's been masking, but for this age group, it's really because of lack of personal interaction and public interaction. So now we've got perhaps as much as 2 times or 3 times as many of this age group all of a sudden exposed to RSV. And when I said only a very small percentage of them get really sick, a very small percentage multiplied by 3 ends up being stressful to the healthcare system. So we are seeing people with infants that come to the emergency department around New England, actually around the country, but right now it's New England, who need to be hospitalized. And in truth, the virus itself is no more virulent. It's just the sheer numbers of people due to what I explained earlier, lack of exposure previously.
I'll leave it up to you, but if you want to put a PSA out there for as much as I'm sure young parents don't want to expose their kids to sickness, because that makes sense. I agree, and I've seen it's even close family members kind of shield their children over the last 2 years, partially because of a lot because of COVID, but really just the amazing system that our body has, especially young, to kind of take on those and build antibodies over those early years, correct?
That is correct, Matt. It's actually a little complicated of a system. It's a combination of getting out there in the world and being exposed, and also participating with vaccination efforts that are available. It's actually both of those things together that have the best protection. Either shielding your child and only getting vaccinations is not as good, and also on the other hand, no vaccinations and just exposing your child is also not as good. Neither of those offer protection, and in fact, just exposing your child without vaccination is dangerous. And unfortunately, every year children die from things like influenza and other vaccine preventable diseases.
That's a very good note. Thank you, Doctor, about kind of the combination there. Speaking of stressing the medical system out, we hear that there's an amoxicillin shortage. Can you speak a little bit to that, and should we be worried about that? And also, what do we use amoxicillin just in our daily, prescriptions as well?
Yeah, prior to the pandemic, for years, healthcare systems have always struggled with some type of medication shortage. It's usually lasts for a few months, and it's usually due to a manufacturing issue. Well, now with COVID, it's all the supply chain, it's all other pressures. And you're right, amoxicillin, but 2 months ago it was other drugs. Right now, albuterol, unfortunately, which is used to treat symptoms of people with respiratory illness that we were just talking about, is in shortage. The good news is that we shouldn't be, as a public, that worried about it. As a healthcare people, we're working hard to make sure that we have the right resources. But there are alternatives to amoxicillin that are safe and effective. Actually, the same is true with albuterol. At this point, there's no reason for the public to be concerned about these particular medication shortages, but it is up to both state and federal legislators to try to remove the situations that lead up to these shortages.
Okay. I think I got another question here, but I think I want to phrase it as I think we've beaten this like a dead horse, but I have all my shots. I have my boosters. Am I protected from COVID, especially as we head into the holidays and this winter?
Yeah, you are much more protected than without them. You still can get the disease. And remember, this hasn't changed. The way vaccines work for the most part is the disease still enters your body and it still has this delayed time where it can replicate and then your immune system responds, of course, much faster if you've been vaccinated or previously seen the virus. But there's still that a little bit of a window in hours to a few days where the virus can replicate. And interestingly, we are so covered now by vaccine and immune response that the virus replication is not as fast, and the levels, it is as fast, but the levels do not get to the same levels that we were seeing just 2 years ago, which is why some of the home testing, and I will just run into this real quick, Matt, why some of the home testing, why you get this initial negative test. Everyone has had this happen now. Back in 2020, when the antigen test first came out, we would occasionally hear about a negative test, and then the next day would be positive. But now people have tested, Monday, Tuesday, Wednesday, they know they've got it, and it's still negative, negative, negative. It doesn't turn positive until Thursday. So much so that the FDA has actually sent out in August and then again on November 1st of last week saying, we know this happens. It's not because the virus is mutating in a different way. It's because that we have such a better immune response. We're keeping the virus load down below the threshold of those antigen tests. The answer, though, is not to then get a PCR test. PCR tests are very expensive, and nowadays they're really just not needed unless someone's going to be hospitalized or they have a particular type of work environment, such as a healthcare person, that they need to know the answer, right this moment. If you test negative by antigen for COVID-19 and you have symptoms, it doesn't matter to me if you have COVID-19, the flu, rhinovirus, or RSV. You should use the same precautions and stay away from others because all those diseases can hurt people.
Right. You heard it here, folks. Doesn't matter. Stay home. Get healthy. Take that time. We do want to remind our audience, if you are watching, we appreciate you taking this time out of your busy work day. It is an important topic, and we like to prepare you for this coming season. If you do have a question for Dr. Dobson, now's your time. You've been hearing a lot of things, maybe some information here and information there. We have an expert on the call who can kind of help us through all those mixed information. So if you are watching, you have a question for Dr. Dobson, or you have a question for me, I may not have the answer, but happy to ask Dr. Dobson. So let's talk a little bit about masks. Those were big things. We're all going to have kind of vintage masks collections in the coming years. But if I don't need to wear it inside, what else should I be doing to be protected and healthy? And I'll put a little asterisk into that because I still think airplanes, even grocery stores, not a bad idea. I think we learned our lesson with the first year. When we wear masks, just the transmission of any type of sickness is a lot less. But what are you doing, doctor, as you kind of go into this winter season with or without a mask?
Right. Well, it's great, Matt. And you were kind of hitting on it. It's really your risk profile. So if you are undergoing chemotherapy, right now you need to be wearing a mask most everywhere and decreasing your socialization. On the other hand, if you're a young, healthy person who doesn't live with someone who's vulnerable, you can forego a mask most of the time and still be okay. You still might get COVID-19, but your symptoms will be much less severe and much shorter in duration, especially if you've been vaccinated or previously seen the virus, or more importantly, both. I will say that your point on travel, this is what people don't quite understand. If you go to the grocery store, there is a little bit of a risk. It's actually not as high as people think. Most people in the grocery store are local, and therefore the transmission is less. When you go to an airport, people are flying in from everywhere, and what that means is that the virus has this quick, circulation. This would be true for any disease pattern you can think of that is at least ones that are communicable between people. And so that's a good time to say, I'm going to wear a mask. I'm going to wear a well-fitting mask or an N95 in these areas. It's not that big of a deal for a few hours. By the way, we've all done this. If you travel a lot, you've gotten the flu over the winter by traveling in airports. And hey, this will, prevent you from being exposed as much. And then finally, there's another group, and that is people who are getting ready to do something really important in life. Now, I know it's never convenient to say, hey, I think I'll get the flu this week, or I think I'll get COVID this week. But if you are getting ready to go compete in the Olympics, it's probably a good idea for the previous 14 days to be wearing a mask and avoiding crowded situations.
Great, and I'll kind of thread this for you because I think you just answered it. But a question did come up on Facebook, and I wanna make sure we get to it. With Election Day tomorrow, and people going to the voting booths, what can we be doing to be protective? As perhaps more interaction with more people in the firehouse, if you're here in Bennington and throughout the county. What should we be doing to be protected?
Yeah, same thing. It's all on risk profile. You asked me specifically, so I'll give you my personal thought. When I go to vote, actually, I've already voted, but if I was going to vote tomorrow, I would, I'm pretty healthy, young, and not around anyone who is immunorisk. I wear a mask, a respirator when I see patients. So I would not wear a mask going in there. And that is just me personally. I will tell you, if I was getting ready to go on vacation, though, I would wear a mask because I want to be healthy for my vacation. And certainly those that are older or at risk absolutely can wear a mask. The good news is no one cares anymore. If this was happening 5 years ago, they might look at you. They may think you have cancer or something. And now we see it as just a way of life. And frankly, a way of life they've been doing in Asia for nearly 15 to 20 years. As a way to stay healthy. It doesn't mean that you have to be so worried that you wear a mask everywhere you go, unless, again, you are in this stage of being vulnerable due to severe medical illness.
Great. Let's shift a little bit. I know we've been touching around this, but let's talk also about the flu and the flu shot. Should we get a flu shot? So let's start there. Let's start very basic.
Yeah, the answer is absolutely yes.
All right. Absolutely yes by Dr. Dobson, which is no surprise there. Where can we get a flu shot? Where can we get a flu shot and a booster, for that matter?
Yeah. So you can get the flu shot actually often at doctor's offices, but really they're fairly busy seeing sick people now. So if you happen to have an appointment scheduled, get it then. Otherwise, you can get them at pharmacies, and you can still. We are giving the flu vaccine as long as we can up at our Southern Vermont location. I will say that may need to stop just due to the. There's a lot more complexity behind the flu shot. There's no federal funding like there was for COVID, but you still should be able to get it. It's worth the $25 or $35, depending on where you get it. Let me just say why. What's the why behind the what there? Even my family, not my immediate family, my extended family will say, hey, I got the flu shot and I got a headache that night and a little bit of fever. And then 2 months later, I got the flu, so it's not worth it. But what they don't understand is that the vaccine itself, it may not prevent the flu. It's usually 40 to 60% effective this year. It's probably going to be more in the 55 to 60% effective at preventing you from getting symptoms of the flu. But just like with the COVID vaccine, it also decreases the time that you're sick. It allows you to return to your Saturday night events quicker, or your work, whatever motivates and inspires you to live. You're going to have more time to do that. And then it also decreases the viral load that you are carrying around, and so protects others from transmission. And I think that part is, your stewardship, your community and civility duties to decrease the chances of transmission. By the way, it's also very safe. That's the same thing with the COVID vaccine. They're very safe. The stories that you hear about are extremely rare and would occur with any type of other types of vaccine, all very safe.
Great. Let's talk about in comparison or kind of in conjunction with the booster, with the COVID booster. So, a couple questions, and I'll kind of give them all to you and we can kind of parse through them. But should we get them at the same time as the COVID booster? And we've also heard, really for that, for your immune system to kind of recover and fight the next thing, maybe 2 weeks apart. And then, what's your personal preference? Do you do it all in one arm, or do you separate the arms? Or so what's your professional opinion on all those questions?
Yeah, so the benefit of getting them at the same time is you're there and it's available. And, think about this, when you get your tires changed, you don't do the front ones and say, I'll just come back in a couple of days and do the back ones, because it's a pain. It's a pain to travel back and forth. And there's no danger in doing it. In fact, it's safe and effective. So getting them in opposite arms, that is the direction by the CDC and FDA and how those vaccines are given. The reasons are not because if you give them in the same arm, something bad will happen, but it allows you to put the shot in two different arms and see if there's any local reaction that may occur. You would know which one caused it, but those things are rare to begin with. Some people can get red splotches where vaccines are given. I'll say this though. There is no necessary benefit in separating them out. If someone just has anxiety about it, then please do it, just as long as you get vaccinated.
Great. One thing that came up recently, and I kind of found it interesting, and I figured I was coming on with you, Dr. Dobson, so I'd asked, is some research does show that, for me, I think I would pop maybe a Tylenol or something like that to make sure that I don't have such a severe reaction, even kind of feeling a little low on the next day. So is taking something, a small pain reliever, with either the COVID booster and or the flu a good thing, or kind of what I've seen in other areas is no, let that work itself through its system. You should have a small fever because that is building up the antibodies. So what are your thoughts on that?
Yeah, so some of these studies you're referring to were small pediatric studies in, I believe, in a couple places in Europe, and it was all in vitro. It wasn't looking at actual disease. It was looking at antibody response, saying that if you took, preemptive or prophylactic nonsteroidal medications, that might decrease, before the vaccine, it might decrease the inflammatory response. And so we carried that over with this huge COVID vaccination campaign that started. It's like, hey, maybe don't take those medicines in case it makes it less effective. And we didn't know what was going on. Well, to this day, we still are going to have difficulty parsing that out. What I can say is that if you don't take the medicine prophylactically, but then you do develop a fever or a headache and want to take the nonsteroidal, there is no problem to do that. There is nothing that is showing that your ability to respond from an immune process is any less. I'll tell you, I had a fever after one of my first booster, and took some Tylenol, felt good about that, and had no problem. But it is generally advised, without much data behind it, just biologic plausibility, to not take those medicines prophylactically. In other words, before you have symptoms.
Okay, great, thank you. Here's, and you had mentioned you came down with a little bit of a fever during one of your boosters. One of the things that as we talk to our workers out there who are working, doesn't matter if you're construction, doesn't matter if you're in the office, and you're like, okay, I'm sold. I'm going to go to CVS. I'm going to get my booster shot tonight. Mm-hmm. Mm-hmm. Is there any recommendation to kind of plan ahead to say, hey, you might want to tell your employer, I might take Tuesday off, or, if you're really planning ahead, you're going to go and get your booster next week on Tuesday, and you're going to say, I'm going to take it easy on Wednesday, really let my body kind of catch up. Any, I guess, professional advice around that, or even HR advice around that?
Yeah, no, it's a tough one. And the truth is people respond so differently, and they respond differently on different times. I would say it's really up to the individual and their own concerns and anxiety level. And by the way, I use anxiety and not in a bad way. I actually mean it in a good way. So like for me personally, back then, I had that fever after one of my boosters, and I kind of felt pretty bad that morning. I took Tylenol. I was delayed probably an hour and a half from returning to work, and was just fine. It came back again about 6 hours later, which was when the Tylenol wore off, and so the acetaminophen. So I took that and felt good. I do know people, and you do as well, who felt like they were out for 24 hours, couldn't really do much. And if they're concerned about that, I would plan ahead. Just as we said earlier, I would probably, if you were getting ready to go do an Olympic event, I would probably hold off. Otherwise, getting vaccinated when you can get vaccinated is so important. I can't tell you how many people that I spoke to were going to, and then they decided not to because of work the next day, and then weeks and weeks later, their schedules just weren't working out. And it's just important to go ahead and get the vaccine. That way you have a strong level of protection from severe disease. And again, as we said earlier, decreases the ability of the virus to replicate in you and transmit, and it also limits the time that you are sick.
Great, thank you. Well, we're coming up to the last little bit of our questions for you today, Dr. Dobson, but I do want to just remind people watching on Facebook, if you do have any final questions for Dr. Dobson, we had a couple there in the beginning, please comment just right in the Facebook chat, and we are monitoring them, and we will get to them if you have any questions for Dr. Dobson. With that, the holidays are coming up. We're doing this because, as we mentioned, we just got over Halloween. We're going to get into Thanksgiving in the next couple of weeks. And then really December is a bunch of holidays celebrated by many people. So a lot of interaction. As we are kind of hosting our many gatherings, what's the timeline for someone who might test positive? What should they be quarantining, and just remind us of those kind of rules and rules of thumb as we want to make sure that the rest of our family members are safe if, unfortunately, we do get COVID.
Yeah, the good news is this information was just changing almost on a monthly basis, and it was driving us all crazy. And we have reached this stability, both with vaccine recommendations and COVID and understanding. And so in general, you should isolate for 5 days, and on day 6, you may emerge from your cave or crib and get out into public wearing a mask. And really, it is safe to do. I don't recommend you go put your face next to someone else and say the mask is protecting you, but you can interact with people safely, and it's been shown now through experience. But you want to keep that mask on through day 10. So let's just talk about this. If you were going to go to a Thanksgiving celebration with your family indoors and it was day 7, you probably just could avoid that. And just, you don't want to be wearing a mask all in the house with everyone else. Just, you could avoid it, and unless it was extremely important. Also, at Thanksgiving, often there are people there that are immunocompromised, and you just don't want to even take the chance on exposing them. By the way, during that isolation period, I was joking, saying emerging from your cave. During that isolation period, if you feel good, people often say, I really don't feel that bad. They should leave the house and get outdoors. There's nothing wrong with that. You just don't want to be around people. I think, unfortunately, early in the pandemic, people locked their doors and just stayed inside, and that led to some both mental and physical health problems.
Yeah, and of course, if you want to make grimaces at your in-laws, wear masks, and then it'll cover it up the whole dinner.
Yes, that's
right.
And
tell them you're just being protective.
Perfect.
Right. Well, any final tips? And here's what I'm thinking about, especially from the chamber perspective, Dr. Dobson. We tend to find kind of a lull in our what I would say our hospitality industry, our lodging, our dining, and even our retail. That'll start to surge up at the beginning of December and gets really cranking up right through the holidays, and even as people want to have that week off from Christmas to New Year's, return gifts. All I kind of say, from here on through to January 2nd, pretty busy time for our hospitality, our merchants. What should they be doing? They're gonna, like you said, like an airport, we're gonna have a lot of people coming up through the county that may not be, local. And what should merchants be doing, and frontline workers?
Yeah, well, first off, that individual support of individuals who want to wear masks. Hey, if I was a hostess and I'm just encountering lots of people every day quickly, I wouldn't mind at all wearing a mask. It would actually be a good thing. It would make me feel better about the risk, because it does increase the risk. So I think, making sure you support staff in that direction, making sure that your staff know that when they have symptoms, they really need to tell you right away. If they take a home antigen test and it's negative, they still really can't come to work because they're symptomatic. And therefore, they need to test again, typically about 48 hours later, before they can say it's not COVID-19. And then, if they still have symptoms, they still shouldn't be working anyway, because it's the flu, it's RSV, it's something else.
We should mention that we are in partnership with Southwestern Vermont Medical Center in their Roundup campaign. So if you are watching this and you are shopping local or dining local even this year, Hopefully most of the stores will have a roundup campaign, and you're probably familiar with that. You go to swipe your credit card, and they say, "Do you want to round up to your local charity?" Well, we partnered with the hospital and our businesses this year to round up for your new emergency room, which hopefully someday you and I will be walking in, Trey, enjoying kind of the beautiful sight of a totally new ER. So we're very excited about that. But for people watching, if you see that roundup on local credit card machines or point of sale systems, make sure you round up for the hospital. They've been a great partner with us at the Chamber and for many of our members. So I encourage you. All right, Dr. Dobson, before you go, any final thing you want to say to the people of Facebook and the people of Bennington County that are watching as we head on into the holidays?
Sure. I hope we are now at a point where the fear and anxiety have declined, and that will reduce the pressure on the divisiveness that we have seen in our community and around the world. We need to make sure that we're listening to each other, we're absorbing others' differing opinions, and working together on the principle of the matter, which is just to keep people safe, healthy, and active.
Perfect. And with that, that's a great way to end. We want to thank our partners over at CAT TV for broadcasting, and of course, our partners at Southwestern Vermont Medical Center and Dr. Dobson for joining us today. Hope you have a great rest of the week, and we hope you have a great holiday season as well. Thanks, everybody.